Hello, I'm Dr. Ralph Stockmann, chiropractor, and today we're going to talk a little bit about bulging discs. This is one of the most common problems that we see as chiropractors, and it's very misunderstood by the medical profession and the general public. So I hope to clear this up today with an explanation of bulging discs. So in your spine, you have 23 movable bones, and in between those bones, you have the intervertebral discs. So this is a spine, and you can see all the bones in the spine. This is the pelvis, and in between the vertebra are the discs. Now you can see the disc actually makes up about 1/4 of the height of the bone. Okay, so as you get older, these discs wear out and they lose their ability to absorb water. So this is actually why when you're older, you're shorter than you are when you're younger, because 20 or so discs times a little bit adds up to a few inches of your height. So the intervertebral disc, it looks pretty much like when you cut down a tree. It has concentric rings of ligaments called the annular fibers, and in the middle, the very center of the annular fibers, is the gelatinous nucleus pulposus. So when you look at the disc as if you're looking at a CAT scan where you're taking slices, you're looking at the disc and it has these concentric rings, and then the central red part is actually a gelatinous ball bearing that's designed to take weight. Okay? Now, when you bend and you lift and you twist, you tear some of those annular fibers, and this causes swelling and inflammation in the body. So the disc will bulge, as you can see by this little red bit here. This yellow is the nerve which goes down the back of your leg. So you can see the proximity of the bulging disc, how it puts pressure on the nerve, and that's the common cause of sciatica, or pain down the back of your legs with a disc bulge. If it's real bad, that pain will go all the way down to your foot. If it's not as bad, it will go to your knee. If it's not as bad, and as you get better, it heals from the bottom up, so the pain will just be down to the buttock and then eventually just in the lower back. Now, a patient will present with a disc problem, and they will be very crooked. When you look at them, they'll be bent sideways, and they won't be able to straighten up. And the reason that you bend sideways is because by bending to the side, you're actually opening up where the disc bulge is. So your muscles go into a protective splinting or spasm to stabilize the spine and to open up the area where the disc is bulging or herniating to take the pressure off the nerve. So that's why you're bent to the side. If you bend into that, then you're going to compress the disc and cause even more pain. So if you have a disc injury and you're bent to the side, stay that way. Don't try to bend against it, because your body is actually trying to protect you from further injury. And this is also the reason why when you have a disc injury, you need to rest. So you should not go to work with a bulging disc when you have pain shooting down your leg, or pain in your back, or when you're bent crooked, because you can damage the disc further. If that central gelatinous nucleus pulposus extrudes and comes out and into the actual spinal cord, it can put pressure on all the nerves, okay? And that can be a worse situation that actually requires surgery. So chiropractic is a way to correct bulging discs very successfully without the need of surgery. In my experience, only about 5% of these disc bulges and herniations actually require surgery. In fact, what they do now is the surgeons will wait for 6 months and see if it gets better before they even do a surgery anymore. So chiropractic is a way to correct these disc bulging. Now, the reason this occurs in the first place is your pelvis, okay, is supposed to be level, a level foundation for your spine to sit on. When your pelvis is tipped or like so, where one hip is higher than the other, well, you can see that that causes a wedging on the disc, and it's going to just wear out one side faster than the other biomechanically over time. So I've never seen a disc bulge or herniation where the pelvis is level. They're always one hip higher than the other. And that's also the reason for regular chiropractic maintenance once a month. If you have a problem with your disc bulging and one hip is higher than the other, that can be maintained very successfully by getting treated periodically, once a month or so, or even fortnightly if you're a tradesman or have a very physical demanding job. But bending, lifting, and twisting together, like for instance picking up luggage from the airport where you bend, you reach, and you twist all together, or the other classic one is starting the lawnmower for the first time, where you're bending and twisting, trying to get that lawnmower started for the first time. Now, bulging discs are very painful, and you know that you have one if you cough and sneeze and you get sharp pain in the lower back or going down the leg. This is called a positive Desjardins triad, when you have pain when you cough or you sneeze or you bear down to go to the toilet. And if any of those cause pain, then that's a sign that you have inflammation in the lower back. You can also get disc herniations in your neck. There are discs in your neck as well, and this will affect the nerves going down into the arm. So with a neck herniation, disc bulge, you can have pain shooting down the arm, and what you'll find is you'll have a very severe, sharp stabbing pain, almost like someone taking a hot poker and sticking it right between your shoulder blades. So that's a sign of a cervical disc protrusion, bulge, or herniation. These terms are used interchangeably. The correct anatomical term is a bulging disc now. So you can have bulging discs in your lower back or in your neck, and obviously they need to be treated very carefully, and I treat discs non-forcefully. I don't believe in manipulation, side posture adjustments, or rotary neck manipulations when you have a bulging disc in your neck or your lower back. Now, these will resolve in about 6 weeks with proper chiropractic care. The inflammation will gradually go away. I have never found analgesics, pain pills, to give any relief for this type of severe pain. So what I use is a natural anti-inflammatory called curcumin. Curcumin in oil specifically works more effectively to decrease the inflammation. So this is the common ingredient in turmeric, which makes the Indian food orange. That's the curcumin, which actually is the anti-inflammatory, and that works better than pain pills in my experience for the relief. What you want to do if you have a disc herniation, if you have the pain when you cough or sneeze, that means there's inflammation. So that's a sign that you need to put ice on your back or on your neck for 20 minutes using 2 or 3 layers of wet paper towel to protect you from frostbite, and then the ice for 20 minutes. Do not leave the ice on longer than 20 minutes because it will have the reverse effect. So you can ice your back for 20 minutes 3 to 5 times a day if you have a bulging disc in your neck or in your lower back. Do not put heat on this. It is not simply a muscle spasm. It is awfully misdiagnosed in the medical profession as a muscle spasm because you're bent to the side, the lateral antalgia. And so the medical doctors see that and they say, oh, it's a muscle spasm. You know, they give you muscle relaxants and tell you to put heat on it. Well, it's all swollen and inflamed already. So if you put heat on it, it will make it more swollen and inflamed. Just think about if you sprain your ankle. If you roll your ankle and it's all big and swollen, are you going to put heat on it or are you going to put ice on it? Obviously, you want to put ice on it to reduce the swelling and the inflammation. And the same thing is true for herniations in the lower back or in the neck. So there's a little information about disc bulging, which is also called protrusions, herniations, slip discs, many other terms, but the correct anatomical term now is bulging of the discs of the annular fibers. These can be seen on an MRI or a CAT scan very clearly. However, keep in mind that if you get an MRI or a CAT scan immediately after your trauma, you will have quite a great deal of inflammatory tissue which also occupies the space. So oftentimes these are misread as disc herniations, whereas if you wait a few days or a week when some of the inflammation is gone, you'll get a truer picture of the amount of protrusion, bulging of the disc on the MRI or the CT scan. On the regular X-ray, you'll obviously see the lateral antalgia where the patient is bent to the side. It's much better if you have pain in your right leg and you're bent to the left side, where you're opening up the disc to relieve the pressure. However, sometimes you can have these disc bulges or herniations centrally right into the spinal cord, and those are much more difficult to correct. A sign of that is if you have pain in your right leg and you're actually bent to the right side, then that's indicative of the more serious central or midline disc protrusions or herniations. So I hope that clears up some information about disc bulging in your lower back and in your neck. Thank you.